In this video, I'd like to talk about some basic guidelines to think about when you are trying to recover and rehab from an injury in Jiu Jitsu. The purpose of rehabilitation is to build resilience in the injured body part. There are many definitions of resilience in a physical therapy context, but one of them can be the ability to adapt and recover both physically and mentally from the injury. And another definition, which makes sense, is the ability to build capacity in that injured body part to handle training load. Here are some basic principles. Let's say I'm training and I injure my shoulder. It's stiff, painful, decreased range of motion. First, I would respectfully submit the first step is obtaining a proper diagnosis from a well-qualified physical therapist and or medical doctor, preferably a physical therapist and medical doctor who train jiu-jitsu and understand what you're going through. The purpose of a proper diagnosis is to guide the rest of the rehabilitation process. For example, with my injured shoulder, I may undergo a plain film, a radiograph. The physical therapist and or medical doctor diagnoses me with an acute rotator cuff strain. However, there can be incidental findings, what we call incidentalomas. For example, the radiograph may show degenerative joint disease, osteoarthritis that was asymptomatic prior to the injury. However, a working diagnosis of acute rotator cuff syndrome or strain has been made. The second step, generally speaking, is to decrease pain and inflammation. And there's a lot of controversy about should I use ice that diminishes the inflammatory response and that can impair healing, etc. But one thing that makes sense is using ice or heat, whatever feels better, especially if you're in a lot of pain so you're not suffering. Non-steroidal anti-inflammatories, acetaminophen, etc. The next step with the physical therapist is to regain appropriate range of motion within that joint. And appropriate range of motion might be different for my shoulder joint versus a world-class starting major league pitcher. But that is the next step, to regain appropriate range of motion. Once range of motion has been regained, the next step is to regain appropriate strength within that appropriate range of motion, sometimes called mobility. And physical therapists many times divide these into level 1, level 2, and level 3 corrective exercises. And they may start you with a series of level 1 corrective exercises that they feel are appropriate for your condition. And then they will progress you to level 2 and level 3 corrective exercises, or regress you back if they are noticing that your capacity to handle that load isn't there. Many physical therapists, after you are handling level 3 corrective exercises, will progress you to dynamic, movement-based functional exercises. And once you're able to handle those, they return you to sport. This is a dynamic process where you are constantly balancing the diagnosis, keeping pain and inflammation under control, keeping appropriate range of motion, keeping appropriate strength, progressing and regressing level 1, 2, and 3 corrective exercises, etc. In whatever you are doing, always think to yourself, is this building resilience to get me back on the mats, or is there another intention for this? For example, some jiu-jitsu athletes enjoy seeing their chiropractor twice a week. Wonderful. If that helps decrease pain and inflammation, or they chalk it up to range of motion, motion is lotion, triggering the release of healthy, high-quality synovial fluid to lubricate the joints, that's fine also. But as you are returning to sport, always think to yourself, what is the purpose of this? Is this contributing to resilience or not? Also, during this process, if possible, try to monitor your vital signs to make sure that you are not in a state where you are impairing your healing. In addition, a physical exam would be very important to make sure you're in a good, healthy state in order to improve healing. Of course, labs. There are many metabolic issues that can impair recovery and healing, such as impaired glucose tolerance, otherwise known as prediabetes, hypothyroidism, low testosterone, vitamin deficiencies, vitamin D deficiency, B12, folate deficiency, iron deficiency, etc. In addition, a thorough medication reconciliation or review is very important. There are many medications that can impair recovery, such as certain antibiotics like fluoroquinolones, Cipro, levofloxacin, can impair healing. Prednisone, statins that are often prescribed to treat hyperlipidemia can impair healing. And then, of course, proper diet, hydration, high quality sleep, controlling stress, appropriate training stimulus followed by appropriate recovery leading to appropriate adaptation, relaxed consistency, and time. So in summary, always think to yourself when you're rehabbing from an injury, how can I build resilience in this injured body part and overall? Obtaining a proper diagnosis, decreasing pain and inflammation, regaining appropriate range of motion, regaining appropriate strength within that range of motion, returning to sport,